Coronavirus concerns, reopening schools in Arkansas. A KARK hour-long special starts now.
I'm announcing today that the remainder of this school year is going to be closed.
In April, COVID-19 changed lesson plans across the natural state. Students headed home. Parents took on the new role as teacher, and teachers moved their classrooms online.
It is a very tough call to make because we know that students depend on so many things for their care and education in their local schools.
Standardized testing, gone. Long-standing traditions for graduating seniors, canceled for the class of 2020. But what about this fall?
We are going to be having school next year.
We want schools to be open, and they will be open, and they'll be open, I think, relatively on time, hopefully perfectly on time, most places.
Now, as schools get ready to reopen, what pieces will teachers and parents have to manage during this puzzling school year?
Thank you for joining us, everyone, for this special presentation. Coronavirus concerns reopening schools in Arkansas. Governor Asa Hutchinson closed campuses to 470,000 students in March when COVID-19 made its way to the state. Now, almost 5 months later, teachers, students, and parents getting ready to enter the classroom once again this fall. We've got a all-star panel, you could say, joining us now for this conversation this evening. Johnny Key, Arkansas Education Commissioner, Dr. Jennifer Dillahay with the State Health Department, Carol Fleming, President of Arkansas Education Association, Teresa Knapp Gordon, Little Rock Education Association President, Dr. Charles McNulty, Superintendent of the Pulaski County Special School District, and Michael Poore, Superintendent of the Little Rock School District. Now that the introductions are done, perhaps we've got a few minutes to tackle the issue of school opening up. Today, Governor Hutchinson announced a state mandate for face coverings, another step in the fight against the pandemic. Some schools are requiring every student to wear a mask. Some are only asking students 10 and older to cover their faces. Secretary Key, I want to start with you. This new executive order, does it change any guidance that you've laid out for school districts this fall as far as face coverings go?
Well, the guidance that we had issued so far in conjunction with the health department made that a strong recommendation. Obviously, at this point, with the governor's new order, we will go back and update that. There are a number of districts already that have locally made that decision to require face masks. So we will continue to work with those local districts in making sure that we abide by the new order. I think the order is good. I think it's a good step toward getting this outbreak in control.
Yeah, it seems like it's moving forward. It's going to be one of those things where these plans are going to be malleable for the most part, and I guess we've got to work with what comes ahead. Secretary Key, your agency, you worked with the State Health Department to create the Arkansas Ready for Learning initiative. It's a guide to help school districts get ready for on-site learning. Districts across the state have been releasing their plans as they fit their districts. They all differ in some degree. For instance, big cities like Little Rock, not the same as rural communities out there. Hillary Hunt went to the Benton School District to see what classrooms there will look like.
There are, 26, 27 people in a room at a time, and that will probably be different.
Second grade teacher Kathy Tolbert explains her new classroom reality to us.
The tables will be moved, we'll be spaced apart.
It's adjustments teachers across the country are facing as kids get ready to flood the hallways for the 2021 school year.
We're all just about worried about the unknown.
As most teachers are in the Benton School District, which is where Health Service Coordinator Cheryl Watson comes in.
We've had hand sanitizers placed on every doorway, in every building, in every classroom, in every office across the district.
She helped lead the health planning for the district, and she says every room will be deep cleaned nightly. Wipes and spray bottles at an arm's reach. Masks are a must, and classrooms will be properly spaced.
Well, if there's anything that we learn as teachers, it's just to expect the unexpected and to monitor and adjust, and that's absolutely what we were going to do.
Kathy says she's just keeping a positive attitude and hopes parents and students will too.
Everybody stop and set a hammer time, Germex time.
Hillary Hunt reporting. That is, of course, just one school's plan. Secretary Key, I want to jump back in with you. Is this a similar plan that districts around the state are putting into place? I mean, can we even say that any two districts will look the same, but is this kind of the same guidelines that everyone seems to be following?
I think you'll see similarities between all the plans. And obviously, because of the nature of and the differences within each school district and between the school districts around the state, you will see variations. I think what you've seen there is a good example of how district is bringing together teachers and staff to create their plans, to tailor those to meet the needs of their individual districts and their individual buildings. In Arkansas, we have over 1,000 different school buildings. We have well over 100 different grade configurations. And each of those grade configurations may be different. In Ozark Mountain School District in North Central Arkansas, you have 3 complete K-12 campuses. It's very unique and very different from those in Central Arkansas. So what we are encouraging districts to do is to take our guidance, take the health department's guidance, and create those plans that make sense for them. Bringing their teachers, bringing their communities and their parents together with Ready for Learning committees to have those community conversations about what those plans should look like in their local area.
Thing that every district is dealing with is the August 24th, no later than 26th start date. How is that going to impact the calendar for districts?
It will require some calendar adjustments. Schools set their calendars pretty early. They can't wait until the beginning or the summer before the school year, so they're really setting those calendars in the spring. And now that there have been necessary adjustments to the start date, they will need to go back and look to see how do they need to take care of things with respect to professional development, the 190-day teacher contracts that most of our educators are on, trying to make sure they get the 178 days of student contact. And they can do that with the Ready for Learning plans through a variety of methods, either on-site or blended learning or digital learning if that becomes necessary.
And planning ahead, which is what districts do, as you're talking about. In the event there's a case of COVID-19 on campus, you release some guidelines to respond to that. What are the response levels? And hopefully that won't be a case. And you can say one way or the other, it may or may not be. But what should the district response level be, or the particular school?
Well, in those guidance levels, those response levels were created in conjunction, again, with the health department. They've been a fantastic partner with us in helping create guidance. But obviously, you're looking at school-connected cases that would trigger one of those response levels. Those school-connected cases have to be weighed and evaluated along with the community spread. So one case in a school may not necessarily create a situation where you have to shut down the entire district. Now, you may have a situation where a building has to be shut down temporarily for a couple of days so that cleaning can be done. Or in a more severe outbreak, you may have to look at closing for an extended period of time. But the response levels guidance that we issued last week should really help districts with those operational decisions. And all of those decisions are made and evaluated in conjunction with the health department and the Department of Education.
Going right from there to the health department. Dr. Dillehay, you're an infectious disease specialist. I want to ask you how you feel about kids returning to school and how you feel about the plans that are in place.
Well, I'm looking forward to kids returning to school because I think that's going to be in their best interest if we can control the spread of COVID-19. I know that if kids are not in school, then they may go places and do things that would increase their risk. So in school setting, we have a little bit more control over the methods that we can use to protect them. So school could be a very protective environment if we do it well. So I'm looking forward to having that in place. I think children will do well if we as parents and communities do what we need to do to protect them. Of course, what children do outside of school will also have an impact on whether or not they are exposed and get COVID-19 and then bring it to school. So we'll have to be thoughtful in our communities about what else children are doing besides going to school.
Interesting thing, lessons learned at school they could carry home, at least while we're trying to deal with all this. For those of you watching at home, we would like your input this evening. what you're doing with your back-to-school plans. Are your kids going to school? They'll be staying home? There are options out there. You can vote in our app, or you can phone us on our online, or you can give us a phone call, or also you can go to krk.com. We're going to reveal results of that coming up in just a minute. We've got a lot to cover right now. So many guests holding, and we want to thank them all for their patience this evening. Coming up, we're going to dive into Little Rock School District and the PCSSD's plan. You're watching a special presentation, Coronavirus Concerns Reopening Schools in Arkansas.